Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been dealing with quite a bit since the last time we met. The back pain hasn't really improved, and it's limiting my activities more than ever. Even with the lidoderm patches, I don't get much relief. Plus, the hernia I mentioned last time is becoming more of a nuisance, especially when I'm trying to be a bit more active.
I understand. It sounds like managing your pain is still a significant challenge. How often are you using the lidoderm patches? And about the hernia, does it protrude more frequently during specific activities or is it random?
The patches? I use them every day, but they only take the edge off, not much more. As for the hernia, it tends to pop out more when I'm doing something as simple as bending over to tie my shoes. It's not just the pain, it's the discomfort and the limitation in movement that's frustrating.
That does sound quite challenging. And how about your smoking? Last time you mentioned you were down to 5 cigarettes a day.
Yes, still at 5 a day. I know I should stop completely, especially with my lung cancer history, but it's been incredibly hard. Quitting smoking has been tougher than I expected, even with some help from the Xanax for my anxiety.
Stopping smoking is definitely a tough challenge, but it's crucial for your health. We'll keep working on that. Now, regarding your cardiovascular health, you mentioned a white sac in your heart during our last discussion. Can you elaborate on that?
Well, during a routine checkup, the cardiologist found this sac during an ultrasound. They said it might be fluid, but we're not sure yet what it means exactly. They suggested a follow-up, which I haven't done yet.
I see. It's important that we follow up on that as soon as possible. Let's ensure we schedule a cardiology consultation soon. Moving forward, how do you feel about your pain management options? You mentioned hydrocodone before. Is that something you'd want to continue?
Honestly, doctor, I'm at a point where I think I might need something stronger. The hydrocodone helps, but on bad days, it doesn't do enough. I've heard morphine might be more effective, but I'm concerned about the side effects.
It's good that you're considering all angles. Morphine can be effective, but it does come with its set of side effects that we need to discuss thoroughly. In terms of your overall health, how have you been feeling, aside from the pain and the hernia?
Well, my weight has gone up a bit, as you might have noticed. It's tougher to stay active with the pain and the hernia. Also, there are days when I feel pretty short of breath, especially when my anxiety kicks in or I try to push myself physically.
Thank you for sharing that. Managing weight is also a key part of improving your overall health and reducing stress on your body. Let's look at the clinical findings and see where we stand. Your blood pressure is a bit high at 160/95 mmHg. Your weight gain is noted, and it's crucial we address this to help manage both your hernia and cardiovascular health. Your respiratory and heart rates are within normal limits, and your oxygen saturation is stable at 92% on room air.
Okay, that's a lot to take in.
I understand. Here's what we'll do. First, we'll adjust your pain management regimen. Considering switching from hydrocodone to morphine, we'll start with a conservative dose and monitor how you handle it. We'll continue with the gabapentin and adjust the dosage as needed. Regarding your cardiovascular issue, I'll arrange a follow-up consultation with cardiology to address the white sac and review your treatment options. We need to schedule another CT scan to monitor your lung condition and check for any changes. I'll also have you complete a set of blood tests today to keep an eye on your overall health. And finally, we absolutely need to focus on smoking cessation. It's paramount, given your history and current health issues.
Thank you, doctor. It sounds like a comprehensive plan. I appreciate your help in managing all these things.
Absolutely, it's important that we tackle these issues together. We'll meet again in a month to review everything, including how you're responding to the new pain management strategy and any updates from cardiology. Take care until then, and please call if you have any concerns or questions before our next appointment.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been struggling with this chronic pain for quite a while now. It's mostly on my left side, my hip, knee, and back. It's really limiting what I can do every day. I've tried various pain relievers, but many of them either don't work well or I have adverse reactions to them. You know about my allergy to naproxen and how I've had issues with other NSAIDs.
I see that does sound challenging. Have you noticed if anything in particular worsens this pain or any activities that provide relief?
Well, the pain tends to flare up with too much activity, but it also gets bad if I sit for too long. I've been trying physical therapy to help with my leg strength and mobility, but the results have been hit and miss. Sometimes it seems to help a bit, but then there are days when it doesn't seem to make any difference.
Thank you for sharing that. And how about your respiratory symptoms? How have they been since your last visit?
They're pretty much the same. I use albuterol when it gets tough, especially during physical activities. It helps, but I feel like I'm just managing symptoms, not really getting better. The idea of possibly having COPD has been on my mind a lot.
Understood. It's good that you're managing with the albuterol for now. We'll keep monitoring that closely. Have there been any changes in your sleep patterns or how you're feeling in the mornings?
Actually, yes. I've been told I might have sleep apnea again, even though I used to manage it pretty well. I haven't used the CPAP in years because I thought I was doing okay, but you mentioned last time that we should probably reevaluate that.
That's correct. Untreated sleep apnea can have a lot of underlying risks, so it would be prudent to have another sleep study done to see what's changed and how we can better manage it. Let's talk about your general well-being. How have you been feeling overall?
Overall, I'd say I'm managing, but it's tough. I've been sticking to my diet, which helps with my diabetes control, My last HbA1c was 6.6%, which I'm pretty happy about. But with limited physical activity due to the pain, it's a constant balancing act.
That's a good handle on your diabetes. Managing your diet effectively is crucial, and it's great to hear that your HbA1c levels are stable. However, I understand the frustration that comes with the balancing act, especially with physical limitations. Let's ensure we are doing everything we can to manage the pain without exacerbating other conditions. Now let's review your recent labs and discuss our plan going forward.
I'd appreciate that, doctor.
Looking at your labs, your kidney function is normal, which is excellent. Your electrolytes and liver function tests are also within normal ranges. The complete blood count doesn't show any significant abnormalities either. Your cholesterol management seems effective with the current statin therapy. The imaging tests, including the abdominal ultrasound and chest X-ray, didn't show any concerning findings. Your bone density test does show signs of degenerative arthritis, which likely contributes to your pain. Now, in terms of the plan, we will continue with your current medications. Additionally, we'll reintroduce Tylenol for pain management to see if it provides you with relief without the side effects associated with NSAIDs. I will arrange for a sleep study to reevaluate your potential sleep apnea. It's important we address this, as untreated sleep apnea can lead to other complications. We'll keep a close eye on your pain management strategy. Given your NSAID allergies, this needs careful handling. Physical therapy and gentle exercise should continue. It's essential for managing arthritis and will also aid in your overall mobility and weight management. Let's schedule a follow-up in 6 months or sooner if your symptoms escalate or new issues arise. How does that sound?
That sounds thorough, doctor. I appreciate you taking the time to go through everything. It gives me a clearer picture of where we stand and what we need to focus on.
Absolutely. I'm here to support you through this. We'll tackle these issues together, and I'll make sure we adjust the plan as needed based on how you progress. Any other concerns you'd like us to address today?
No, I think that covers all my current concerns. Thank you for being so comprehensive.
You're welcome. Looking forward to seeing how you progress. Take care until next time.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
The challenge we face with limited resources such as ventilators, medications, and staff during natural disasters requires a strategic approach. We must prioritize based on urgency and potential for recovery.
Absolutely, but we also need to consider the ethical implications. It's about fairness and the equitable distribution of resources. How do we decide who gets what without bias?
That's where protocols come in. Developing clear, pre-approved guidelines that can be quickly implemented ensures that we make these tough decisions transparently and justly.
I agree, and community engagement is crucial. Understanding community needs and expectations can guide us in crafting these protocols more effectively.
Now look at question 26.
It's important to recognize the signs of preterm labor early. Look for symptoms like regular contractions before 37 weeks, which can feel like a tightening in your belly. Other signs include back pain, pelvic pressure, and changes in vaginal discharge. If you notice any of these, you should contact your healthcare provider immediately.
I understand. How can I manage these symptoms at home? Or when should I consider it an emergency?
Great question. Minor symptoms can sometimes be managed with rest and hydration, but any regular contractions or significant changes warrant a visit to the hospital.
Now look at question 27.
Accountability in clinical decision-making is crucial. Healthcare professionals must be responsible for the decisions they make, especially when patient outcomes are at stake.
While I agree with the principle, we must also consider the systemic issues. Sometimes decisions are influenced by factors beyond a single provider's control, such as resource limitations or institutional policies.
True, but that doesn't absolve individual accountability. We need mechanisms to ensure that decisions are not only made well, but also reviewed and learned from.
A balance of systemic and individual accountability is necessary then. It ensures learning and improvement without unfairly penalizing providers.
Now look at question 28.
Today we'll discuss your upcoming immunotherapy treatment. It's used to help your immune system fight the cancer more effectively.
I've read a bit about side effects. What should I expect, and how will we manage them?
Common side effects include fatigue, skin reactions, and sometimes flu-like symptoms. We'll monitor you closely and can adjust the treatment if necessary to manage these effects.
And how will we know if the therapy is working?
We'll do regular scans and tests to track the progress of your treatment and make any adjustments needed.
Now look at question 29.
Today we're exploring the significant barriers immigrants face in accessing cancer screening services. Language barriers, lack of information, and cultural sensitivities often prevent many from seeking necessary screening. Socioeconomic factors and fear of healthcare systems due to immigration status also play a critical role. We need targeted interventions that include language support and culturally sensitive health education. Collaborations with community leaders and organizations can help us bridge these gaps, ensuring that all community members have equitable access to cancer prevention and early detection services.
Now look at question 30.
I have to share some difficult news about your test results. Unfortunately, the treatments we've tried haven't been successful, and the illness has progressed to a terminal stage. I want to assure you that we're here to support you through this, focusing on your comfort and quality of life. We can discuss palliative care options and what you can expect in the coming weeks. It's also important to think about any personal matters you might want to arrange. I'm here to assist with any questions or support you might need during this time.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at extract 1.
Good afternoon, everyone. I'm Dr. Elaine Carter, a urologic oncologist specializing in bladder cancer. Today, we delve into the intricacies of bladder cancer management, focusing on the application of precision medicine in diagnosis and treatment. Bladder cancer presents significant challenges due to its high recurrence rate and the potential for progression from non-invasive to invasive disease states. A critical aspect of improving patient outcomes is early detection and precise characterization of the cancer, which can significantly influence treatment decisions and outcomes. Let's discuss a recent case that illustrates these points effectively. Consider a patient. Let's call him Mr. Johnson, a 58-year-old male diagnosed with non-muscle invasive bladder cancer, NMIBC. Mr. Johnson initially presented with hematuria, which is blood in the urine, a common symptom of bladder cancer. The traditional approach would involve a cystoscopy to inspect the bladder lining, and if tumors are found, a transurethral resection of the bladder tumor, TURBT, would be performed. In Mr. Johnson's case, we utilized an advanced diagnostic approach incorporating molecular profiling and targeted imaging. According to research published in the Harvard Medical Review, integrating genomic data can significantly enhance the accuracy of bladder cancer staging and prognosis. We performed a comprehensive molecular analysis of the tumor tissue obtained from Mr. Johnson's TURBT. This analysis revealed specific genetic mutations that were indicative of a high risk of recurrence and progression. Given these insights, the decision was made to proceed with a female-at more aggressive surveillance and treatment strategy. This strategy included intravesical Bacillus calmette-guerin (BCG) therapy, which is effective in reducing recurrence and preventing progression in high-risk NMIBC patients. Furthermore, Johnson was enrolled in a clinical trial exploring the efficacy of a novel immunotherapeutic agent targeting a specific pathway identified through his genetic analysis. Over the course of treatment, we monitored Mr. Johnson's response through liquid biopsy techniques. These involve the analysis of cell-free DNA in urine to detect tumor DNA, a method proven to be minimally invasive and highly effective in tracking tumor dynamics. Over several months, these tests demonstrated a significant decrease in detectable tumor DNA, indicating a positive response to treatment. This case exemplifies the power of precision medicine in the management of bladder cancer. By tailoring the treatment approach based on detailed genetic insights, we not only optimize therapeutic efficacy, but also minimize unnecessary treatments, which can often carry significant side effects. The integration of genomic profiling, advanced imaging, and liquid biopsies represents the future of personalized cancer care. As we continue to understand the molecular underpinnings of bladder cancer better, our ability to predict disease behavior, tailor treatments, and monitor responses will undoubtedly improve, leading to better patient outcomes and a paradigm shift in how we manage this challenging disease. Thank you for your attention, and I look forward to any questions you might have about this exciting field of medicine.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Today, I will be discussing the intricate relationship between chronic stress and brain plasticity, with particular focus on how enduring stress can alter neurological structures and functions, and the potential interventions that can mitigate these effects. Our exploration is based on several scholarly articles and a detailed case study that exemplifies these concepts. Chronic stress is a pervasive issue in modern society, affecting an array of psychological and physiological processes. Neuroscientific research increasingly underscores that prolonged stress can significantly impact brain plasticity, leading to alterations in both the structure and function of the brain. According to a recent review in the Harvard Review of Psychiatry, chronic stress triggers a cascade of chemical responses, which can impair neurogenesis, particularly in the hippocampus, an area critical for learning and memory. The impact of stress on the brain extends to the alteration of neurotransmitter systems, including serotonin and dopamine, which are crucial for mood regulation and reward processing, respectively. Prolonged exposure to stress hormones, notably cortisol, can dysregulate these neurotransmitter systems, leading to manifestations such as depression and anxiety. To illustrate these concepts, let us consider the case study of a patient referred to as Mr. A 45-year-old male with a long history of work-related stress. Mr. A reported symptoms of memory lapses, difficulty concentrating, and persistent sadness. Neuroimaging studies indicated significant shrinkage in hippocampal volume, consistent with findings from ongoing Harvard research linking hippocampal atrophy to chronic stress exposure. Given the extensive damage that stress can inflict on the brain, it is imperative to consider therapeutic interventions that can restore or even enhance neuroplasticity. Cognitive behavioral therapy, CBT, as outlined in a Harvard clinical trial, has shown promise in this area. This form of therapy aids individuals in developing coping mechanisms to mitigate the perception of stress and its neurobiological impacts. In Mr. A's case, CBT was instrumental in improving his symptoms, particularly in enhancing his cognitive functions and emotional regulation. Another promising intervention is mindfulness-based stress reduction, MBSR, which has been the subject of extensive research, including studies published in the Harvard Mental Health Letter. This intervention focuses on promoting mindfulness, a mental state of awareness and presence in the moment, which has been shown to decrease stress responses and foster neuroplasticity. Mr. A participated in an 8-week MBSR program, which was found to notably decrease his cortisol levels and improve his overall psychological well-being. Physical exercise, particularly aerobic exercise, is another intervention that has received considerable attention for its role in enhancing brain plasticity. A study from Harvard Medical School suggests that regular aerobic exercise can increase the size of the hippocampus and improve neural health by boosting the production of neurotrophic factors, which support neuron survival and plasticity. Understanding the neurobiological pathways through which chronic stress impacts the brain provides us with crucial insights into designing effective interventions. The case of Mr. A highlights how a combination of CBT, MBSR, and regular physical activity can be effective in not only mitigating the deleterious effects of stress on brain plasticity, but also in promoting mental health resilience. As ongoing research continues to unravel the complexities of stress and neuroplasticity, it is critical that we integrate these findings into clinical practice to better support individuals like Mr. A in managing chronic stress.